Hello, I am Naima Chabra, and a lot of girls my age have a lot of questions and concerns about their bodies. So today we are here with Dr. Aparna Sharma, Senior Gynecologist at Alchemist Hospitals, Panchkula. Hi Dr. Aparna, it's a pleasure to have you here.
Hi Naima, same here.
So let's try and answer some questions that women might have.
Definitely.
So most girls are worried when they miss or have a delayed period. So what could be the reasons and when should they actually be worried?
Yes, missing periods causes lots of anxiety, and it's normally taken periods should come regularly, one should not miss. Universal truth, if a lady is sexually active, married, she should first go in for her pregnancy test, rule out pregnancy, then we think of other things, like it can be just one odd cycle she has missed, it can be a hormonal imbalance, endocrinological problem, some drug induced, it can be PCOS also. So many things we need to investigate then.
So you mentioned PCOS, which is very common these days. So could you please tell us how to prevent or control it?
Yeah, PCOS is an ovarian problem where the ovaries they become bulky under the influence of hormonal imbalance, which is usually influenced by endocrinological problems also. And nowadays this is basically because of the sedentary lifestyle the girls are having and the wrong eating habits. It's the wrong lifestyle, I'll say. They gain weight, they have acne, they have increased body hair growth, scalp hair fall. We all, males and females, we have both the hormones. Males will have male and female hormones also, and the females will have female and male hormones also. So the imbalance of these two hormones, when it takes place, it leads to PCO. Girls, they get delayed periods and then they gain weight. Once they gain weight, the PCO increases, so it becomes a vicious cycle, and I attribute this to wrong lifestyle, and we need to be very active where our day-to-day activity is concerned, our exercise is concerned. Nowadays children are having work from home, all the more bad. They are not going for their regular walks, exercise. About that, work is keeping them stressed, again a negative point. Thirdly, wrong eating habits, because work from home 24 hours they are on their PCs. As a result, they are not eating home cooked food. Everything is being ordered, which is junk food full of calories. So these all attribute to PCOS.
Alright. So most of us are also very uncomfortable using public restrooms for fear of infection. So is it true that they might cause a UTI?
So when we are using public toilet, it's the rim which is coming in touch with our skin, not with our part which is passing urine. So direct UTI from there is not possible. It is basically the rim which is dirty can give you skin problems.
Alright. So we are hearing a lot about HPV these days. So what is the right age to get an HPV vaccination?
So HPV stands for human papilloma virus. This is one of the major causes of cancer of cervix. So to prevent this, we have vaccination which is called HPV vaccine, which starts from 9 years onwards. Maximum efficacy is till 26 years, though we can go beyond that also, but the effectiveness goes down. If you take from 9 to 15 years, you require 2 doses. Above that, you require 3 doses. And this can prevent various genital warts also.
What is the right age for a girl to start regular gynecologist visits, and when should they be getting regular pap smears?
Well, I'm proud to say where Indian mothers are concerned, they are the first teachers, and definitely when the girl, she gets her periods, we call menarche, they bring the girl to us, and then we explain them about the periods, the regular periods, the normal pattern, the abnormal behavior of the periods, and then once she comes, thereafter they should come every 2 years for their regular checkup, 2 to 3 years. There's no hard and fast rule, definitely, but it's always good to come for their breast checkup also, routine checkup, and definitely if there's problem they can come earlier also.
What is the best way for women to maintain personal hygiene?
That's again a very, very good question. With so many products in the market and they are doing so well where marketing is concerned, simple plain water and soap are best. there is no requirement of any vaginal wash unless specifically advised by the doctor for recurrent vaginitis or anything which the doctor feels. Otherwise, plain soap and water, and there is no need to do vaginal douching. So I have so many girls, they do vaginal douching. This is not recommended.
Okay. And so many women have very painful periods. And how do we define pain, and when should we be worried?
See, pain during periods is a normal phenomena. If it becomes very excessive, then definitely we need to take some medicines. And pain during periods we define as primary and secondary. Primary is okay, it's a normal ovulation. The girl who gets ovulation will have little pain, that is called dysmenorrhea during periods. Other thing is, she gets pain because she's got fibroids, she's got any endometrial polyp, she's got endometriosis, any growth in the uterus which can give her pain. And this, here ultrasound plays a role and guides us what is inside, and then we manage accordingly.
So what are normal periods and what are...
So here I interrupt, there's infection is also one of the causes for pain.
Alright. So what are normal periods and what are abnormal periods?
Well, normally a girl, she gets periods, bleeding during periods for 3 to 5 or maximum till 7 days, and she gets periods after 24 days. 24 to 35 days is taken normal. Even if she comes down to 21 is fine. If it is lesser than that, we again need to investigate, and if it is more than 35 days, we need to investigate, because some pathology like even thyroid problem can cause, or there are fibroids inside that can cause, a polyp can cause increased bleeding. Another endocrinological and hormonal problems can cause increased bleeding, and delayed also, as we discussed earlier, PCOS also is one of the causes, and some other hormonal problems. See, thyroid is very notorious. It can give us both the things. So that comes first thing in mind when we talk of abnormal periods.
Thank you so much, Dr. Aparna, for such an informative session. I'm sure this will answer a lot of questions that girls my age have.
You're always welcome. Thank you very much.